Hi there everyone and welcome to today's lesson. Today's VR lesson is on the liver. So we're just going to have a basic look at protocol, anatomy, a bit of pathology and also scanning skills. Now when we're looking at the liver, we try to position the patient in a posterior oblique position and then rotate accordingly to rid of bowel gas. So we may have to roll in the decubitus position, we may have to put the patient supine or erect just so that we can get a good window of our HEPA tissue. Now in patient preparation, once again we should all know, patient fasting for 6 to 8 hours, have a few sips of water, don't restrict yourself too much. Diabetic patients need to be booked first thing in the morning, obviously, and also children will be booked first thing in the morning also. Now patients need to refrain from smoking and also from chewing gum, as that instills bowel gas, which causes dirty shadowing over our liver. Okay, so we're going to take a look at our left liver first of all. So patient, big breath in there for me. Okay, so what we're seeing here is our left liver. Now, as you can see, we've had lunch and we've got a bit of water in our stomach. So we can see the fluid pouring through our stomach, which sits adjunct to our left liver. Now, this is our left liver lobe seen in a longitudinal scan or longitudinal plane, as we can see here. Now, we'll just let the patient breathe away. That's it. And big breath in, hold your breath, that's it. Okay, so what we're seeing here is our left liver. We've got the IVC running underneath, as you can see there, and we've got our lobes. Now, this is our lateral segment, so this is superior, inferior, and now this is anterior and posterior. So what we're seeing here, we've got our IVC, a caudate lobe here, our left portal vein. Now we know that's our left portal vein because we're seeing the echogenic rim on the vessel, and that means it's full with collagen, and therefore we know it's a portal vein. Now we'll have a look at the hepatic veins a bit later on. They're different, and we'll see those a bit later on in our scanning. So big breath in there. So having a look at the left side of the liver. Now we're in our longitudinal plane, we're scanning all the way through. Now of course you'll be learning a different scanning technique, but we're doing this in brief for our VR lesson. Now we're just going to turn in transverse and we're seeing our left side of our liver here. So breathe away patient, we're going to fix our focal zone, big breath in. So we're doing the lateral aspect of our liver, so we can see our lateral tip, which we'd like to keep on. Coming down to our stomach, we can see our stomach there, full of fluid. Lateral tip of the left liver. Now this is our left portal vein, as we can see it there, coming through, going all the way through, and coming down once again through our left side of our liver. Now moving along to our right side of our liver. So we're just going to pan over to the right side. So I've hardly even moved my probe. I've just panned over and we're looking at the right side of the liver. Now big breath in there for me. So this is our right side of our liver that we can see here. So this is our diaphragm. Now this big bright thing that we're seeing here is our diaphragm. It's a specular reflector, and therefore the ultrasound waves, you can breathe away patient, our ultrasound waves will be coming down, hitting the specular reflector and reflecting back, and because it's a nice smooth surface, it will give us this nice line. So here we have our diaphragm, which is going up into our lung fields, and this is where we look for a fluid, particularly in cancer patients. So we're looking for diaphragmatic fluid and subcostal fluid there. So we can see our nice uniform echotexture of our liver or our HEPA tissue, and we've got our focal zone sitting nicely down here in the bottom third of our liver. Now if we're having a look over here, we can see on the screen our centimetre gradient. So this is our ruler, as we can see here, and sonographers can often use this as an eyeball to assess the liver to see if it's enlarged. So we're looking for hepatomegaly, so that's an enlarged liver. Now our liver measurement, which we'll get to a bit later, is conducted when the patient is supine, and we actually measure it mid-clavicular line, so in between the clavicles with the patient flat. So this liver measurement, you're allowed to have it up to 12 to 15 centimetres, just depending on the size of the patient. So we'll just start our assessment of our right liver again. Big breath in again. So we're in a longitudinal plane here. And one thing that I can see in this patient is we're getting a lot of shadowing here from the gallbladder. Now, this gallbladder is actually pathological. So let's have a look at that just for a second, just getting sidetracked. So this gallbladder is actually exhibiting a wall echo shadow. So breathe away, patient. So what we're seeing here is the gallbladder wall filled with stones. So this is filled with calculi. So this is actually the wall echo shadow, or a Wes sign. So we'll learn about these in our lectures also. And what we're seeing here is this acoustic shadowing, because the ultrasound cannot travel through the calcium oxalate or whatever the stones or calculi is made from. So let's just keep going on. So we'll show you that in a longitudinal plane. So there's our gallbladder, there's our pathological gallbladder. Big breath in for me. Let's set our focus up there. Can you see that? We're just getting a heap of shadowing, so we're not seeing the gallbladder. There's our main lobar fissure, there's our common duct, our portal vein, and we're getting all of this shadowing from all of these stones that are seen here. So there's the bowel. We can see the bowel peristalsis. We know that's not the gallbladder, but here we can see the gallbladder, and in a transverse plane, this is a dead giveaway. Can you see that there? It's quite obvious. However, it's not painful. Now, in this patient, breathe away, patient. Now, what we can do as sonographers to test for this, so this looks like quite a chronically inflamed gallbladder, we can do a test called the positive Murphy's test. So if we were worried that that was an acute gallbladder, we could actually push in and let go and just ask if there was a pain response, or look for a pain response. Now, I know that that's quite a chronic problem because there's no rebound tenderness, or there's no pain upon letting go. So that's a positive Murphy sign when we're pushing down. So where probe pressure is a positive Murphy's, okay? So just be warned of that when you're looking at pathological gallbladders. Now back to the liver. So let's just have a look at the liver. So we're going from the left over to the right. Now big breath in, patient. So we're just going over to the right side, and we're in the longitudinal plane. We would just want to open up our focal zone. I might take harmonics off because we need some more penetration, and we need to optimise by using our TGC and our 2D gain. So here we're just having a look all the way through that liver. So we're getting up there all the way through, just panning through, having a look, and breathe away, patient. So we're just going to do one more sweep. Big breath in. So remember, you won't be scanning like this in scanning skills. You need to do a lower focal zone, you need to do a higher focal zone. We're just having a basic look for our VR study today. So we're having a look through that liver in a longitudinal lie. Breathe away. Okay, so now we're going to start our transverse scanning plane, and what we're seeing here is the portal vein. So I'll show you that so that you know round about where to find it. Big breath in there for me, patient, that's it. So this echogenic walled vessel is our portal vein, so we're seeing it there. Breathe away. So it runs in a parallel tram track fashion, and we're seeing it, this is the right portal vein traversing into the liver. So portal veins go into liver segments, hepatic veins divide up liver segments. So as we can see, we've got our focal zone there, and if we wanted to do an assessment of that portal vein, we could actually try and come up intercostally. We can see that portal vein there nicely, can't we? And we're going to actually put the colour on. Now, at the end of this term, or next term, you'll be actually asked to do a Doppler assessment. Hold it. Okay, so we're just going to look at getting a portal vein trace there. So the patient's holding their breath, and we're just going to get a portal vein trace, looking at the blood flow going into the liver. So this is actually called hepatopetal flow. So breathe away, patient. Now, if we measured that, that should be anywhere between 20 to 30 centimetres per second, and we've got it there. So red means the blood flow is going up towards the probe, so it's going into the liver. So that's hepatopetal flow. So we're just going to take all of our Doppler off there, and we're going to go back to our liver. So this is our portal vein with our echogenic walls, and we're just going to do a sweep in transverse, and we're going to have a look at our liver tissue or our hepat tissue. Small breath in there for me. Hold your breath. Okay, so we're looking up into the diaphragm. We're right up, angling up, and then we're having a good look at all of that hepat tissue, and we can see the diaphragm down the bottom, and we're just getting some shadowing from that gallbladder with the stones. Okay, breathe away. Okay, big breath in. This time we're going to have a good look at the hepatic veins. So as you can see there, these three little black slits are called the hepatic veins. Now, when they're occluded, sometimes we can, in children in particular, breathe away, there's a disease process known as Budd-Chiari. Now, Budd-Chiari is when there's a thrombus or a membrane occluding the IVC and the drainage of the liver actually is restricted. So here we're seeing our right hepatic vein, our middle hepatic vein, which separates the right and the left liver, and our left hepatic vein, which comes down, and this is our sunrise sign that we're seeing here. And we're angling up towards the right shoulder. So big breath in there, patient. That's it. So we're seeing right hepatic, middle hepatic, and left hepatic. As you can see, they're draining into our IVC. And if we turn on that, we can show you that that's our inferior vena cava. So let's have a look at that. So there's our inferior vena cava there. Okay, so which is running into our right atrium. So here we have our portal vein again, once again, portal vein, hepatic veins, remember they don't have echogenic walls. Big breath in, patient. So they don't have echogenic walls like the portal vein, so that's how we differ them. So middle hepatic divides right and left, and we've got the right hepatic, left hepatic vein there. So that's the basics of liver anatomy and scanning. Now, disease processes that you want to be aware of, the major disease processes with the liver are things such as cirrhosis, which affects the entire liver. Now, there's acute and chronic, and there's differences between acute and chronic processes within cirrhosis and throughout the disease process. There's also hepatitis. Now, there's many types of hepatitis. The main adverse disease process that you've heard of is Hep B. So just be wary, take universal precautions when you're scanning the liver. Always glove up and always ask questions of your patient and write anything that you find out from your patient down on your worksheet. Now, other disease processes that you may have to look for are hepatic cell carcinoma, HCC, and also when a person actually has a disease process such as cancer, you may have to extend the study and look for things such as ascites. So ascites is extra fluid. You can get exudative and transudative, and we may be looking for these in the abdominal cavity. Another thing, another disease process that we may actually investigate also is thrombosis. So in a diseased person or a diseased state, the body has a higher coagulation factor, so it may be our job to actually look at the IVC and the hepatic veins and ensure that we rule out thrombus. Now, there are many disease processes which are covered in the lecture, but we won't go into these with our VR study today. All right, so that will do for our VR study of the liver. Thank you for your attention and thank you for listening.